Sydney's gonna put her 2 Raytex up.
One would be wet, the one on the towel for when you wipe balance and for when you wipe off.
Right, that's important when the camera operator will clean off with the wet sponge and then go to the fog. You don't want to take a dirty scope, put it on your fog, because then now your fog's all bloody. Okay, we've done our timeout, we're ready to go. I'll take local.
I have quarter percent sensor cane.
Take knife. The Varus. Top clips first. And then you can help. Normally we would have an assistant over here. They put the Varus in. They usually listen for 2 towel clips, or 2 clicks of the Varus. We're going to do the drop test. Put on to make sure that the fluid goes down, and they can also aspirate back. That time I'd ask for insufflation to start. On low flow, we wait for the pressure, and then we would go to high flow. This is going to increase the pressure in the abdomen so that there's room to work. That's complete. I'll take a 5 trocar. That's going in. At that time, Jamie can come in with the camera. He's going to look around. We're going to see where we're at. We're going to visualize the gallbladder first, and then we're going to go ahead. He's going to look up at the top so I can put in my 10 trocar.
I usually, depending on the scope, you'd want the light cord to be at the top, or 12 o'clock.
That's when you look down. But now that we're putting a trocar in, we'll be looking up, so your light hand will be at 6 o'clock. And then this is my 10. Nothing. And then I'm going to put 2 accessories over here. Then I'll take a grasper and, okay, start with this. So this person, the assistant over here, would grasp the gallbladder and they would retract that up. I'll take a grasper. And we would go in and start identifying structures to identify the cystic duct and the cystic artery. And then we could use right angle to go around those. We'd be dissecting the fat off of it. We take a right angle to make sure that we can go around the duct and the artery. And then I take a clip and a scissor. And that's pretty standard on the gallbladder. We'll clip, and then they'll cut those. Usually at this point they'll take the suction irrigator with the cautery on it, depending on the doctor, and they'll start dissecting that gallbladder away from the liver. They can take the gallbladder out with a jaws. And I'll take the endo bag. Actually, I'll put the endo bag first. This would get put in, just a bag to put the gallbladder in. Then I'll take this. I'll take the jaws, put that into the bag. We get it out. We'll use curves. We're grasping the bag, pulling the gallbladder out of that 10mm incision. We have it, and then we're ready to, we'll check for bleeding. irrigate some more, and then we'll close that part. I'll take the suture grasper.
We should do a count since we are closing.
This just gets put in around the trocar sites. It gets put down. Jamie's still visualizing all this. I release that, and then I pull up the other end, and then I can tie that 10 millimeter trocar site. Usually just the 10s and the 12s, 15s, we don't close 5s. And then we're ready to close skin. We can turn off the gas and the light. We always want to pay special attention with the light that it's not on any drapes to cause a fire. And then we can close skin.
Let's simulate a count. I'll be the circulator.
We'll take a skin stitch while you're counting.
Okay, sponges.
Oh, sorry. All right, sponges, we have 1, 2, 3 on the field. 4, 5, 6, 7, 8, 9, 10 sponges.
Blades.
1.
Fog.
We have 1. And the bottle and the cap.
Injectables.
1.
What else you got up there?
Suture.
Suture.
We have 1 and 2.
Okay.
And since we all stayed laparoscopically, we didn't need to count our instruments.
If we would have opened, then I would have recounted the instruments. Do you want me to go ahead and count the instruments just to show? Okay. All right, so for
Cow clips.
cow clips, we have 1, 2, 3 clamps. We have 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22 clamps, needle holders. We have 1, 2, 3, and 4. Oh, there's more clamps up here. We're going to start all over again with the clamps because they were out of order, so sometimes that happens, so then you just start all over and it's no big deal. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30, 31, 32. Knife handles, we have 1 and 2. Suction tips, we have 2. And then pickups, we have 1, 2, 3, 4, 5, 6, 7. And retractors, we have 1, 2, 3, 4, 5, 6, and 7. Eight, 9. And that is it for the counts. The nurse will tell me that they're correct or incorrect, and then we'll go back and count again if they are incorrect. All right, so now we can go ahead and close.
And typically on the final count, the nurse leaves that count